Hi folks, Cosi Belloso here, physical therapist, amputee specialist, and the host of Cosi Talks. Now in the last two videos, we talked about how your limb goes through the inflammatory response and the proliferative phase during the healing process, and how these changes affect the shape and volume of your limb. We also discussed how you can manage these changes to help keep your limb comfortable in your prosthetic socket. After your limb has closed the wound and it appears healed from the outside, the inside is still undergoing significant changes. This is what we call the remodeling phase. During this phase, the soft tissues continue to remodel. More mature scar tissue is laid down, and the site of the wound becomes stronger and more flexible. Now, this phase can last up to 2 years. After this time, does your mature limb magically freeze and stay the same forever? No such luck. Just like the rest of your body, your residual limb will continue to change for the rest of your life. Even after your limb is considered mature, your journey doesn't end. And here's why. A mature limb doesn't necessarily mean a stable limb. It's kind of like having a teenager. They might be fully grown, but they're still going through a lot of internal changes. A mature and stable limb means that during the day, it may undergo changes that will require you to adjust your socket fit, but those changes are predictable. So take my buddy James, for example. James has been an above-the-knee amputee for over 30 years. He starts his day by wearing a 5-ply sock, by lunch he adds another 5-ply, and by dinner he's up to 15-ply. He puts his shrinker garment on for the evening, and the cycle starts all over again the next morning. Similarly, my other friend Lou follows a routine during the day, only he uses the RevoFit to adjust the fit of his socket on the go. Now, both Lou and James understand well enough to know how their limb will respond throughout the day. If Lou eats salt and vinegar potato chips, or if James loses a lot of fluid after playing golf in the hot Florida sun, they can anticipate how their limbs will change and adjust their socket fit accordingly. But what happens if your limb is mature, but not stable and predictable? A lot of times, the main reason for this unpredictability comes from the medical history of the amputee. So let's take it back another step. The majority of amputations in the US are due to vascular disease or complications from diabetes. And just because the surgeon amputates your limb doesn't mean they've amputated the underlying condition. Unfortunately, vascular disease, diabetes, high blood pressure, and other conditions are still going to be present in your body and can continue to affect your residual limb volume, even long after the surgery. If you've been out of surgery for 2 years or more and are still experiencing unpredictable changes in limb volume, I would take a look at your medical history. Now, ideally, this is something that should be done from day one. But sometimes folks focus on the immediate swelling from surgery and forget that the underlying conditions can also affect limb volume. If the cause of the limb volume changes is due to an ongoing medical condition, the priority is to get that condition under control as best as possible. This includes working closely with your medical team and making regular visits to the appropriate clinicians, such as your primary care doctor, your endocrinologist, your vascular surgeon. Getting some of these medical issues under control is a team effort, and you need to have that support. Now, I understand that some conditions are difficult to manage, even with the best of care, but that doesn't mean that you have to accept the frustration or discomfort when it comes to managing your limb volume or your socket fit. The good news is the principles that you learned in the previous phases of healing still apply. Number 1, understanding how your socket should fit is key to keeping your limb comfortable in your prosthesis. It is important to continue working with your prosthetist and physical therapist to communicate when your fit isn't right and to adjust accordingly until you get that perfect fit. If you're still using socks, make sure they're the right thickness and fit for your changing volume. Now, I'm always advocating for my patients and viewers to explore all the tools available on the market. This includes encouraging folks to ask their prosthetists about adjustable socket technology like the RevoFit. With the RevoFit, You get that effortless socket fit adjustments with a simple turn of a dial. So you can adjust your fit of your socket on the fly as needed. No need to add or remove multiple socks throughout the day, which means less bulk and more comfort. So whether you're out and about or just going through your daily routine, this technology gives you a really customized precision fit that makes the socket adjustments a breeze. Number 2, don't forget that managing your limb volume also applies when you're not wearing your prosthesis. Remember to keep those shrinker compression garments handy and in good shape. Now, for many of you, your underlying medical condition is also greatly affected by what you eat. I've become much more vocal about nutrition in recent years. What you eat and how you hydrate can have a huge impact on your body, especially with conditions like diabetes or high blood pressure. Investing in your health with a registered dietitian and customizing a diet plan can really, really pay off. At the end of your day, managing your limb volume successfully is not just about one thing. It's about understanding your limb, your environment, your medical conditions, and using the right tools to stay comfortable. Managing your limb volume does not have to be a daunting task, and with the right strategies and support, you can maintain a fit that works for you. So I hope this video series helps guide you through this process. And if you want to explore options like the RevoFit adjustable socket system, don't hesitate to reach out to your prosthetist or contact the Click Medical team for more information. Thanks for tuning in. Bye.